survive the disease much better if we diagnose it in an early stage. So we are asking people to be skin aware, aware of their moles. Self-examination is important. We don't want you to be paranoid, but from time to time you should have a good look at your skin. Every few months, having a quick look at the moles, make sure they are, remaining stable, important. If you're doing self-examination every 3 to 6 months, looking at your skin thoroughly, that's sufficient. Well, probably 60% of all the melanoma in women will be on the leg, on the lower leg, even on the lower leg, because it's more on the lower than the thigh. And then, most males, 60 to 70% will be on the torso. But obviously the rest could be anywhere, arm, head. But what's very interesting about melanoma, although we link melanoma to acute exposure to sunshine more in childhood than later, you don't get melanoma in a chronically sun-exposed site. So it'd be extremely rare to have a melanoma presenting on the back of the hand, or such as the face. Melanoma on the face is not common at all, unless you are obviously the unlucky one to be balding, and then you may have melanoma in an area of the skin which is not used to have lots of sun, because you should have lots of hair to protect you. You should have a good look at your skin. On area of the body where you're not able to see, such as the back, you may need the help of a partner. If you're living alone, there are very good way of doing it with mirrors. It's not hard. You can have a mirror and look at the back of your leg. You can have a mirror, look at on your back with another mirror in a bathroom. So there are very well described protocol for self-examination on your own, which are available on the internet. They are very easy to find. iPhone have excellent picture quality these days, and they can take a close-up picture of their mole. Every photo on an iPhone is dated anyway, so they know exactly when they took it, and then maybe 6 to 8 weeks later take another photo and see whether there are any changes over time. There are also some apps which are very easily downloadable from the Apple Store, where you can actually have within the app a storage of your image and some clues about what you look for when the mole looks a bit odd. So there are extra tools now to self-examine and store your pictures. The human eye is very clever. You don't need to be a medical person to look at somebody's back from far away and realize one mole is suddenly completely, out of shape and doesn't belong to the rest of the mole on a back, for example. What we're asking really is to look for things that don't belong. What I always say to my patient, look for size. They are bigger than your average mole. They have irregular borders. They are asymmetrical. All shades of brown are fairly normal in a mole, but when you start getting some black, some red, some blue, some pink, we worry. So you look for change in color, irregular border, increase in size, and loss of symmetry. So compared to all your other moles, it will not belong anymore. You will suddenly see a mole that has very different characteristic to all the other moles, and that would be a trigger to either go and see your GP first or go and see a dermatologist for an opinion. It's important to seek medical advice if you're worried. There's certainly some patient where we see denial and they just don't want to go and see the GP. They're a little bit worried about the outcome of the visit, and they may delay the diagnosis, which is obviously not good. In London at the moment, the waiting list for dermatology is very long. It brings a lot of anxiety to our patient because they want to be seen, and there are delays in being seen, even in a private system. So what we are trying to do is help those patients who would like to be reassured about a mole. We now have a service where the patient can contact the clinic directly over the phone, and they will also be able to do some internet booking. They book directly with a nurse who does the photograph. It's taken with highly performant camera with very high resolution. That is transferred to the clinician, the dermatologist, who then give an advice within 24 hours and reassure the patient that there is no need for further examination or surgery, or say to the patient they may want to see them face to face for further evaluation.